All right. So, after reading Chapter 5, From Research to Practice and Policy, I found this chapter to be probably not my favorite. I think it was because it was mainly just a lot of information being thrown out at once. And I think that's what kind of, turned me away from the chapter. So I guess some of the things that were mentioned in this chapter, it says right here, it's like at this chapter, I'll revisit some of the topics discussed earlier, specifically from this perspective. How can we translate research into actions that make a difference in the lives of people everywhere, but especially those experiencing health disparities? And doing so requires that interventions be based on evidence and that researchers partner with communities, health systems, and other sectors of society to change practices. It also requires policy at local, state, and national levels within the healthcare system and in other sectors to explicitly reduce health disparities while also improving overall population health. And then, so if we just keep going through the chapter, something that kind of was interesting was the importance of racial and ethnic diversity in health professions. So it says, as the U.S. population becomes increasingly diverse, ensuring adequate workforce representation could improve organizational excellence, increase access to health care for persons from underserved communities, and reduce disparities in health and healthcare. Part of this professional underrepresentation stems from a similar imbalance in university and medical programs. Studies show that racial and ethnic diversity leads to improved academic and workplace environments, including better education experiences for medical students of all racial and ethnic backgrounds, higher ratings of preparedness to care for patients from other racial and ethnic backgrounds, more positive attitudes about equity and access to care, increased academic reputation, greater creativity and innovation, better problem-solving skills. And something else that was mentioned is, while 100% matches of patients to healthcare, healthcare workers who come from similar racial and/or social backgrounds isn't the goal. All professionals should be able to treat any patients regardless of their ethnicity. Research has shown that patients of color in race concordant relationships report higher levels of satisfaction and participate more in decision making, experience visits characterized by better communication and more patient positive effect, report higher intentions to use preventative healthcare services, have higher level of adherence to medications for heart conditions, are more likely to prescribe HIV medications in a timely manner, and have significantly better health outcomes in some studies. So if we just keep going further into the chapter, something that I noticed, it was under the bias reduction and anti-racism training. It says, educators have proposed a framework for integrating implicit bias recognition and management into health professions education that's based on previous research and includes the following practical actions for curriculum developers. 1. Creating safe and non-threatening learning settings. 2. Increasing knowledge about the science of implicit bias. 3. Emphasizing how implicit bias influences behaviors and patient outcomes. 4. Increasing self-awareness of existing implicit biases. 5. Improving conscious efforts to overcome implicit bias, and 6, enhancing awareness of how implicit bias influences others. This approach can be used for practitioners and researchers, and I think that's something that's like extremely important to talk about, is like creating a safe space for people just so that they're able to get the help that they need.